Hello dear colleagues, this is Erika Mendoza from Germany talking about compression against nausea and vomiting in early pregnancy. This study was supported by Sigvaris concerning the payment of stockings and materials and the payment of statistical advice. Known indications for compression in pregnancy are treatment and prevention of edema, thrombosis prevention, thrombosis treatment. Possibly it could help to prevent a progression in varicose vein disease, but the new option is now presented here, the treatment of nausea and vomiting in pregnancy. 50 to 80% of pregnant women suffer from nausea and vomiting in pregnancy. It has a negative repercussion on the quality of life. And up to now, no proper therapy has been found. Pregnant women prefer not to take drugs. The human chorionic gonadotropin is the highest in the first trimester. And the higher the concentration, this correlates with more nausea. And again, nausea and vomiting correlates with less death-born children and with a higher birth weight. Hormones in pregnancy lessen the efficacy of smooth muscles, like those in the esophagus, in the stomach, in the intestines, but could also be the reason for nausea and vomiting. Nausea and vomiting, on the other hand, could be a reason to make the lady, the pregnant lady, more conscious of herself, taking care, not working too much, so protecting the newborn. But how did the idea of testing compression against nausea and vomiting come up? During the pregnancy of my daughter, I had nearly no nausea during the working time, but at the weekends the symptoms were worse. I kept asking myself for the reason. And after some weeks, I noticed that at the weekend I used not to wear compression. So I started asking patients in first pregnancy weeks, which visited my office, about their nausea symptoms. And if I had to prescribe them compression, I phoned them up a week or two later to ask how the nausea was doing. And nearly all of them had noticed that the nausea was less or gone. Possible ways of action of compression in early pregnancy could be the following. In the first trimester of pregnancy, the blood volume is increased approximately by 1 liter, and this is a relative reducement of hemoglobin is the consequence. The vein wall also suffers relaxation from the progesterones. So the calf vein reservoir might be more filled in this situation. Compression reduces the calf vein filling, thus keeping the circulation blood volume higher, and this could be more blood for the brain and possibly for the digestive organs. The intensity and development of nausea during pregnancy has been studied by other authors. The shaded bars shows the intensity of nausea every week, and it is obvious that between week 7 and 10 the peak is highest, and that between week 8 and 16 there is a little decrease in intensity week by week. So to include a woman in a study, it is difficult to find her before week 10 or 12, because first she has to go to the gynecologist, then he has to tell her or she has to find out about the study. So we would have to do the study in the decreasing symptoms phase of the pregnancy. The study design was an intra-individual comparison with and without stockings in the same lady. The same woman wears 2 weeks compression and 2 weeks not. The order, if compression is the first phase or compression in the second phase, was randomized. If you remember, the intensity of symptoms decrease with the pregnancy week starting from week 10, and to avoid this fact to influence the result, the order has to be randomized into 2 groups, compression first and compression second. The aims of the study was the analysis of the effect of compression on nausea and vomiting and dizziness, as well as lag-related quality of life and tiredness between week 8 and 16 of pregnancy. The participants were pregnant women over 18 years with mild or medium nausea and vomiting pregnancy. 74 women were randomized and 58 finished the study. The following exclusion criteria were applied: severe nausea, signs of venous disease, post-thrombotic syndrome or edema, because in this case the women had to wear compression always, no arterial pulse, which was never the case. If the lady needed custom-made stockings, she was excluded, or if she already was wearing compression. The study was performed with Sigvaris cotton knee-long compression stockings in compression class 2. They were provided with 2 pairs of compression stockings for the 2 weeks with compression. And we found no significant difference between group 1 and 2 concerning age, weight, BMI and social data. Group 1 was compression first. They were 2 weeks compression followed by 2 weeks without. We randomized 33 ladies and lost a follow-up 4 of them, 3 for abortions and 1 because the questionnaires were not fulfilled correctly. So finally we could analyze 29 of them. In the group 2, compression second, the patients had 2 weeks without compression followed by 2 weeks with compression. We randomized 41 ladies and 12 of them were lost to follow-up. 3 had an abortion and 9 just didn't return for the second visit. So finally we could analyze 29 of them. In the first investigation we made an anamnesis, a physical examination, ultrasound of veins, measurement of the leg perimeters, and if we found an edema, a previous thrombosis or varicose veins, or if custom-made compression was necessary, the lady was excluded from the study. In the first telephone contact, we checked these exclusion criteria as far as possible. Then we scheduled on a short term a visit, the day 0. Then the day crossover at day 14 and a final day at day 28. On the day 0, the ladies fulfilled a general questionnaire, and if they were eligible, they had to sign the informed consent and they had to complement the questionnaires. After the completion of the questionnaires, the ladies were randomized and they were explained the daily questionnaires they had to complement at home. On the day 14, it was the crossover day. We repeated a physical examination, measurement of leg perimeters. The ladies had to fulfill questionnaires of quality of life in pregnancy and civic. The same on the day 28, where they also had last questions concerning the study. The questionnaires we used in the office was nausea and vomiting quality of life, which are 30 questions concerning nausea and vomiting, psychological and physical complaints in early pregnancy, validated in studies. The civic questionnaire were 20 questions related to leg symptoms as edema, itching, pain, and their repercussion on social life, psychological complaints, also validated in studies. Then we added 4 additional questions concerning dizziness and tiredness, which were not validated in any study. The ladies had to fulfill questionnaires also at home daily. The PUKE questionnaire, validated in studies, are daily questions about frequency of vomiting, hours of nausea and repercussion on the day. We added 1 question in the phase with compression, asking how many hours the lady did wear her compressions at the day. The results on one side are that 100% seems to have had a good compliance during the compression wearing phase. Asked if they would recommend compression during pregnancy to a friend, 80% said they would do so. In the result, there was significantly less nausea and vomiting when very compression, and less leg pain, less psychological and physical complaints. Looking at other studies previously performed on the evolution of nausea and vomiting during pregnancy, we can see the dotted line, which is the mean overall value for nausea and vomiting from literature, and the blue line show the reduction of the symptoms during week 12 to 20 of pregnancy. This graph shows our results in contrast to the literature results. The line is the group compression first and the dotted line compression second. In orange, it's the phase with compression, and in black, the phase without. You can see in both groups the phase with compression has a higher reduction of symptoms, and the phase without compression has a slow reduction of symptoms, most similar to those published in other studies, as shown in the blue line. The tested aspects were physical impairment, negative feelings, tiredness, nausea and vomiting, the dizziness added by the authors, and we evaluated the change in comparison to baseline, which was the results of day 0. If you have a look at the percentual change to baseline for the total, but also for the individual aspects of the questionnaires, in blue you see the change to baseline without compression, and in orange the change to baseline with compression, which is much larger in all aspects of the studies and highly significant. Very interesting is the change in dizziness and tiredness, which were the added questions where the change was highly significant. Another way to show these data is in box plots. You can see the week 9, 11, and 13 and compare the groups for compression first and compression second. In blue, those weeks without compression. In orange, those weeks with compression. And during the first 2 weeks, both reduced the value, which is the orange arrow, but compression did reduce it much more than without. In the second 2 weeks, we see the violet arrow. The group without compression had a worsening in the symptoms, and the group with compression, which was the group compression second, showed a large reduction of symptoms. Considering the dizziness and tiredness with compression and without, we could show that in the 2 weeks with compression, these symptoms improved, and in the weeks without compression, the symptoms get worse. Having a look at this leg-related quality of life, it was obvious that compression improved these symptoms. Coren and colleagues studied the effect of doxylamine and pyridoxine on nausea and vomiting in pregnancy and tested the effect with the daily PUCIS score. The changes they recorded resulted in less quality of life reduction than the STOCKINGS in our daily PUCIS score. This antiemeticum is approved for pregnancy by the FDA, and now, at least in Germany, it is also allowed for pregnant women. So we can sum up that compression in early pregnancy has an effect on nausea and vomiting, which is similar to those of medicaments. Varying compression in early pregnancy improves significantly the leg-related quality of life, nausea and vomiting, and tiredness and dizziness. Compression stockings could be a non-pharmaceutical alternative to relieve symptoms in early pregnancy and improve quality of life of the women. Further studies could and should enlighten these mechanisms, and it is obvious that women should prefer wearing compression than taking any pill during their pregnancy. I thank you very much for your attention in listening and following this presentation. And I thank Sigvaris Group for supporting this study.